Hi, everybody. I'm Angela Hart, and this is Heart of the Earth TV show. Thank you so much for tuning in. Isn't it terrific that you can now go to the dentist and receive an injection without feeling pain? There's really a device that is a computer-controlled, pressure-controlled infusion and aspiration system. It's for medical and dental instruments, and we have a guest today that I'm so excited to introduce to you. His name is Leonard Osser. He's the CEO of Milestone Scientific. No more pain. This is my new hero. Please meet Leonard Osser. Welcome again. Welcome, Leonard.
Thank you very much. It's a pleasure to be here.
Thank you so much for coming on. Leonard, first, I want to ask you how it is that you came up with the idea to invent this fantastic device.
Well, we had a core technology which was invented by a dentist, and that technology allowed the dentist to do injections that they could not otherwise do. You know, when you go to the dentist, they give you an injection, they come back and forth into the room asking you if you're numb yet, making you perhaps more nervous. Then when you admit to being numb, they give you an injection, which they miss the target about 20% of the time.
Yes, and so we don't get fully anesthetized.
You don't get fully anesthetized. They have to re-inject, but they have to wait about 12 minutes for that to ascertain that they have in fact missed. So it takes a lot of chair time. It's disruptive for the practice. It makes the patient even more nervous. So the original invention, which I did not do, enabled the dentist to give an injection to a single tooth, which cannot be done any other way. It can be done only as a secondary injection when you're already numb, but not as a primary injection. The product that we had was capable of doing that, but there was no feedback to the dentist that you were in fact numb. So I came up with the idea, which was later invented by Dr. Mark Hockman, our Director of Clinical Affairs, who is the world authority on computerized injections, and that idea was to do a schematic of the density of tissues leading to the target, surrounding the target, and at the target that the injection would take place. If those algorithms could be embedded into the computer, along with the algorithms of the injection itself, the friction created, the viscosity of the drug, the temperature of the drug, so on and so forth, we could then ascertain exactly where the point of the needle was, and at the same time deliver the drug below the patient's threshold of pain.
This is the part I like. This is the part that amazes me, that the actual injection is administered below the
Patient's threshold of pain.
threshold
No
of
pain.
pain.
Painless
This is
injection.
amazing.
Yes, it is, but we have it. As a matter of fact, the FDA has, in our approval, states that we can say this is a painless injection, not virtually painless, but a painless injection, which it is because the computer controls the injection. Our competition is the syringe, which we all hate, which, by the way, was invented in 1860.
Oh.
So it is time for a new technology, and we've given over 65 million injections worldwide. We have never had a problem with safety. It is a wonderful injection, and there's a big advantage because given that we inject the single tooth rather than a whole quadrant of teeth,
which is very painful.
it's very painful, and you leave the office, in fact, feeling numb for a couple of hours.
Right.
So, but with us, being that you can inject, the dentist can inject the individual tooth, there is no collateral anesthesia. You don't realize you're getting an injection, and when you leave the office, there's no collateral.
I just can't get over this. Now, will this product replace the hypodermic needle?
Absolutely. You know, there's no reason for the hypodermic needle that adults and children fear. We have 40 million dental phobics in the United States.
I'm one of them.
We have people that cancel appointments at the very thought of leaving in the morning to the dentist. 25% of the appointments made to dentists in the United States are canceled, mostly because of fear of the dentist giving an injection with the hypodermic syringe. We remove that fear.
So that means that this has financial benefits to it also for the medical community.
Most definitely. First, Patients don't cancel. When they get the card every 6 months to come in for an examination, they come in for the examination because they don't fear the injection. As far as the dental operatory goes, it's much better for the dentist because they don't have disarray, like they can act like any other business where they don't have to worry that so many people are going to cancel. If people show up, where did they put them? It's very disruptive. But in addition, there's another aspect. Dentists in the United States have the highest alcohol abuse rate of any medical professional.
Well, yeah, because everyone says they hate going to a dentist. They can't stand the service it's a necessary evil. And so now there's the psychological aspect to it you're hitting on.
Exactly. They have the highest drug abuse rate of any medical profession, and they share the highest suicide rate with psychologists.
Oh my gosh.
Yeah, people are not aware of this. And it's all because of the fear that they pick up when they're giving the injection. Now, they're smiling, they're perhaps telling you a joke. They're very good at that. But they're internalizing what the patient is putting out to them. And this eliminates that for the dentist. It's a major invention. It goes far beyond dentistry because the technology now is in a product for Milestone Scientific, which we're a small research and development public company on New York Stock Exchange market. And we will very shortly be bringing out a product for epidurals, which is unfortunately, an injection that is not the safest injection. It's quite a problem for morbidity, and also for injections between the bone, intra-articular injections.
What does that mean for the layperson, intra-articular?
What intra-articular means is any injection between the bone. For example, you feel pain in your knee, you go to the doctor, they do an x-ray, and they determine that you're one of the 29 million Americans where the synovial fluid, the cushion between the bones in the knee or in the ankle, in the hip, has dissipated. The body does not replace that. So at that point, you're given an injection of local anesthetic, which hurts a great deal, and the doctors can't determine exactly where to place the needle.
So there's two issues. One is that it's painful, but is it because the doctors can't decide where to put it, determine, or it's painful anyway?
It's painful anyway because you have inflammation because the bone rubbed against bone with no cushion in between. When the physician gives the injection into the area of local anesthetic, they're doing that in advance of a very painful injection of a steroid. What happens with the patient then goes home, waits a few days for the inflammation to dissipate, goes back to the doctor then gives them, once again, a very painful injection of local anesthetic, waits 20 minutes for profound anesthesia, and then gives them a drug called hyaluronic acid, HA. That replaces very well the synovial fluid, and the patient will then have nice movement of the bone, perhaps 90% movement, but they have a chronic disease. They have to return to have these injections every 3 or 4 months, 3 to 4 times a year.
And so with your product, how is it different?
With our product, what happens is we give the injection of the local anesthetic without pain, and because we have pressure force feedback, in other words, we have measured the density of all the tissues, ligament, muscle, fat, in that area where the injection should take place, around the area, and the area leading up to the target site. Because of that, the doctor will not give the injection prematurely if they think they're in the site where they're not, which happens very often with epidurals.
So people are getting poked unnecessarily.
They're getting poked in different areas unnecessarily. And it's barbaric,
yes,
but it is 1860 technology. It should be barbaric. But what we do is we take what was an art in the hands of a doctor with the hypodermic syringe, and we have turned it into a science.
Okay, now, how does the liquid actually get in there if we're not using a needle?
We're using a needle, but we're not using a syringe. In other words, the syringe has a needle attached to it with a very small inner diameter, but it has a large reservoir for the liquid, and it has a plunger.
You mean the old-fashioned kind?
The old-fashioned.
Okay, what's yours do?
Well, what you're doing is you're pushing with your thumb, and when you meet resistance, you have no torque. and you can only push harder.
Right.
So when you go into tissue that's dense, you push very hard, the resistance grows, you push harder, but when the needle comes out, you push very hard, and that's when the patient experiences profound pain and develops a phobia. What we do is the computer reads exactly where the needle is, but it controls the flow and the pressure of the drug as it enters the tissue.
Wow.
So it's,
But you do feel a small prick, maybe.
you don't have to feel anything. I could give you acupuncture and you won't feel that needle.
See, I've never gone for that, but I hear
No.
it's painless, so it's the same idea.
It's painless. What it is, it's not the pinprick, it's not the needle that causes profound pain.
It's the pressure.
Exactly.
This is fascinating. Viewers, this is just so fascinating to me. I can't get over this. So we've talked about it being useful in the dental industry, and now you were talking about arthritis for
Yes, osteoarthritis. We have 29 million people in the United States that are on the regime that I just described for osteoarthritis. If you're, let's say, 65 years old or over, and you have this in the knee, they could do a knee replacement could be done. But if you're under that, being that they only last 10 or 15 years, you're put on this regime instead. You could be put on this regime for the rest of your life. It's far less expensive, and it's not a surgery.
Meaning they could use this system, CompuFlow it's called?
Yes.
To continue getting treatment and not have the pain of the treatment.
Correct.
And it would deliver what it needs to deliver to the site of the bone meeting bone.
Exactly.
And what are they're putting something in there?
Yeah, what they're putting in is a drug called hyaluronic acid. It's been around a very long time. It's very effective. And what that drug does, prior to it dissipating after 3 or 4 months, it gives you very good movement of the joint. And therefore, you do not get an inflammation, and therefore you do not have pain. So you come in regularly for these injections, as I said, 3 to 4 times a year, and you can function almost normally with this, and it's
This is
preferable to
wonderful.
surgery.
Wonderful. Now, also you said it was useful for getting epidurals?
Yeah, epidurals, we have approximately 4.1 million births in the United States. Of the 4.1 million women giving birth, 2.4 million choose to have an epidural. The other ones read the risk factors. The risk factors are very, very high. The lowest morbidity might be 4 to 6 weeks of severe migraine headaches. It's substantial. The
injection causes the
The
headaches?
injection. What happens is this. There is a space called the epidural space. You take a needle 4 to 6 inches, perhaps, depending on the size of the patient, and you advance with your thumb on a plunger, a syringe, if you will, until you feel a loss of pressure against your thumb. This is, once again, technology
From
born
the
of
1800s.
From the 1800s. Because the epidural space has a lower pressure component than the surrounding tissue, when you feel the loss of pressure against your thumb, you believe you're in the proper space. Between 13 and 35% of the time, depending on the doctor, you will miss that space. In other words, you'll have a false positive of what we call a fat pad. You will then remove the saline solution from the syringe for finding location. You will then put on a syringe with an anesthetic solution, put that in, and hope that the woman in labor or the person in the pain management center gets profound anesthesia.
I would not want to go through that based on what I'm hearing.
Well, it's even worse. It's even worse because
Without your system.
It's even much worse because what happens is if you go too far, in other words, if you're in the epidural space and you then go beyond the epidural space and you nick the fine membrane that surrounds the spinal cord, if you just touch the membrane with the needle, you've created morbidity. You make a hole in that,
Oh
and you
my
have the
gosh.
leakage of cerebral liquids.
Oh my gosh, this is awful.
Yes, the
But
patient-
with your product, tell
That
me about
doesn't
your-
happen.
I can't get over this.
We are in a study right now for FDA approval in the United States. The product has been cleared in the CE community.
What does that mean?
In the European community, we can sell the product
Mm-hmm.
for both the epidurals and the intra-articular injections. The study, we have completed a majority of patients in the study, And we have had 100% success in locating the space, 98% success in locating the space the first time. But it's obvious with the computer and with our technology, when one understands the technology, it's obvious that we could do that. But the morbidity, when the anesthesiologist goes beyond the epidural space and nicks the membrane, can be up to 2 years of a transient paralysis, could be a lifetime permanent paralysis.
So you are saving lives. You're eliminating pain. This man, I think we should nominate him for a Nobel Prize. I'm not kidding you.
I only had the idea. Dr. Hockman invented it.
Well, you had the idea, and you knew that it could be done technologically. You just
Yes.
needed a technician to do it. Is
Yeah,
that the
we
idea?
needed a lot of people. We needed to actually develop the physics which did not exist so that we could then develop the algorithms for both the site of the injection and the part of the injection that takes place within the computer. So it was quite a long undertaking, cost a great deal of money, took many years. But as I say, we're giving injections. We've given injections to over 65 million people in the area of dental. These two products I just mentioned should be on the market in the United States by the end of this year.
Oh, 1 second. You mean they're not yet?
No, the epidural instrument and the intra-articular instrument are going on the market shortly in Europe. We are waiting for FDA approval, which we anticipate somewhere in the middle of this year.
But the dental ones are here now.
Yeah, the dental one.
So how can somebody find a dentist that does pain-free injections?
It's very simple. There are thousands of dentists doing this throughout the world that have moved from the 19th century to the 21st century. If you go to The Wand, W-A-N-D, thewand.com, and you'll see on our first page, you can press a button which says Find a Dentist. You then enter your zip code, and you will see all the dentists within your zip code that have our instrument, that have the Wand STA instrument. So it's very easy to do.
What about for diabetics? I mean, this is very useful.
There are so many areas because the underlying technology is so precise. We are now working on ophthalmic injections, which are very painful and difficult to find the
Yes.
site. If they're overpressured, can cause significant damages.
Yes, that sounds very important. And how soon will that come out?
That's probably 3 years away from coming out. But we're also doing peripheral nerve blocks, which if you have morbidity associated with that, it's quite terrible. We're looking at various other areas of medicine.
But let's stick with the ophthalmology for a minute.
Sure.
I don't know if I'm using the right term. So right now, a lot of people get injected when they have cataracts, a simple procedure like cataracts.
You know, yes,
And
front
there's
of
a
the
lot
eye
of
infection.
danger involved with that.
Well, if it's, for one, the pain, they eliminate the pain by giving the patient a topical drug, which takes about 20 minutes to take effect, but that topical is very, very painful to patients.
Really?
So if you could eliminate that pain, which you can with our instrument, I strongly believe, then you can not only eliminate the pain, but you could deposit the drug in
More
the
precise
exact
manner.
right spot, which is very important because if you're injecting with a syringe, you have to use far more drug than you need because of the high pressure. The drug goes beyond the target, so you might use a third to 50% more drug to get the drug needed in the location. But when we give our injections, we find the perfect location, but we put in the amount of drug into the target so it doesn't have to go elsewhere. So it's a site-specific injection.
So is this something that a person can self-administer, or it has to be from a
No,
professional?
a doctor has to do this,
Do you think in the
or an
future?
anesthetist nurse or a nurse.
Because I'm thinking for all the diabetics who suffer with having to do injections, do you think at some
Yeah.
point you'll develop it more for
Absolutely.
users?
For diabetics and for other people, for example, people with diseases of the anti-immune system, such as Crohn's disease, have to inject a few times a week into the abdomen. It's very painful. In the first instance, it's very painful. Next, it's very difficult to find a location. Next, the doctor doesn't know because the patient does it at home. There's no way to know when they injected, how much they injected. If we develop a small computer, and because it's a computer, we have a record of the injection, which, by the way, is required in the Affordable Care Act. You
What's
must keep a
required?
record if you can.
Of,
Yeah, of the injection. You must have a record of anything that you do in the medical sector. You have to embed that into the mainframe of the hospital, for example. So if you're using a syringe, you can't do it. But if you can do it with our instrument, then you must use our instrument. So as we move through the years with Milestone Scientific into different areas of medicine, we fit many requirements other than reducing the pain and making it pain-free, other than making it far safer. We're able to keep a record of the event, which is very important for both the doctor, the facility, and the patient.
so you're dealing with pain, alleviating that. You're alleviating or complying with legal issues,
Yes.
which is what you're discussing with the Affordable Care Act. What else are we doing here? We're reducing psychological trauma that people go through when they're faced with having to get injections and have aspirations done. This is wonderful. What else can we apply it to?
Well, podiatry, for example, we can cut costs dramatically. One of the things we do is cut the malpractice because we make it much safer. In podiatry, if you have a spur on your foot, what happens today with the syringe is you have conscious sedation or general anesthesia. Then you get an injection called an ankle block with the syringe. The reason you have to have conscious sedation is the injection for the block is so painful to the patient. You can't give it without conscious sedation. Then you do the procedure. The patient, because of the dislocation and the problems, vomiting, so on and so forth, from the anesthesia, has to spend 1 to 3 days in the hospital. What we have proven at Scholl's School of Podiatric Medicine in Chicago, we have proven that we can give the ankle block, no general anesthesia, no conscious sedation. The doctor does the ankle block, they do the procedure, they wrap the patient walks out. So there are numerous, wherever you can give an injection, pretty much, you can use our instrument to do it far better. It's a matter of moving into those areas. Actually, the far-reaching technology, which allows us to have the pressure force feedback and all the controls, is the idea that I came up with. The idea of controlling the flow rate of the drug was one that a dentist had in Pennsylvania. He was working with a company that was insolvent. I was very interested in the technology. They had patents on the technology, but they never developed it. They never developed prototypes, so on and so forth. So I got involved with that company, helped financed it, and then we developed the original core instrument. Because of the inability of the dentist to know the location of the space and find the exact space, out of necessity, I came up with the idea for the pressure force feedback to measure the density of the tissues, which allows us to do this.
You came up with the idea. You
I came up with that idea, but as I say, our clinical director, Dr. Hockman, went through the excruciating difficulty of actually inventing it. It takes many years, and we've had many people involved with it.
Were you afraid to go to dentists as a kid?
No, I had no particular
No,
fear
but-
of the dentist. The only reason I overcame my fear because when Dr. Fern finished the procedure, he always had a beautiful box of chocolate and gave you a piece of chocolate. So as a very chubby kid, this was allowed me to overcome my fear.
Wow, wow. And what about your background as far as, growing up or something? Just share any anecdote that you'd like to share.
Well, I was brought up in New York. I was originally from the Bronx. I then moved to Manhattan when I was about 17. I've traveled a lot. I've lived in Texas. I live part of the year because we do a lot of work overseas. So I live part of the year in China for work there, which has made a very, very big difference, particularly for children and the fear of the dentist. But it's beyond the fear. For example, in NYU, there is a pediatric center which is quite excellent, and they have our instruments on every chair in that pediatric center. And I was there one time, and I heard one boy was very upset, almost crying that he had to get an injection, and the other boy said, "No, they don't give injections here. It's not necessary." But that boy had gotten over 10 injections over the last year. He just never realized that he got an injection because they don't see it.
Right.
And they don't feel it. So it makes an enormous difference. Also, they don't end up in an emergency room because when you do the block, which they have to do if they don't use our instrument, the block anesthetizes not only the quadrant of teeth,
Yes.
but it anesthetizes the cheek, half the lips, and half the tongue. So it's fun when you're numb to bite on the inside of
isn't
your
it
cheek.
fun? Right.
Adults do it also.
Yes.
So the child bites into it, gets an inflammation, ends up in the emergency room. We prevent all that.
Oh, what a fantastic product. I'm so glad you
Thank you.
came on. Now, if a dentist wants to, for instance, a dentist to start with in America wants to buy this product or subscribe to it, how does it all work? Let them know, please.
It's very, very simple.
right here.
We have just made an arrangement with the largest dental distributor in the world, Henry Schein. They're located nearby, actually, on Long Island. They're a worldwide multi-billion-dollar company. And in the United States and Canada, they will distribute our product. So one simply has to get in touch with Henry Schein and buy
Wonderful.
one. They're relatively
That
inexpensive.
was my next question.
It's very inexpensive. They're under $3,000 in the United States. Certain countries, they're $10,000, but here they're $3,000. The disposable, which keeps it much safer for the patient because it's a disposable, it doesn't have to be sterilized, is under $3. So it's very inexpensive.
And so how is that compared to if they had to buy a bunch of hypodermic needles to use?
The hypodermic needles, the average dental operatory will have 40 of them because they'll have an autoclave, a sterilization unit. It has to go into the sterilization unit. They have to buy the needle. Ours comes with the needle.
So the cost is about the
cost
same?
is, well, the $3 is more money, probably. The other cost probably is about $1.50. So it's
Okay.
inconsequential.
Okay, and my last question is, once the medical physicians start using this product, is it covered, some of them are using it in America?
No.
Not yet.
We're waiting we, along with many funds and the investment community, are waiting for FDA approval, which should come, we're hoping, in the middle of the year for both the intra-articular product and for the epidural product. But the clinical study for the epidural will finalize within a few weeks. So we're at an inflection point with the company.
We're going to close. One last question. Will it be covered by insurance?
Yeah, eventually it will be covered by insurance. The study that we've done was particularly large for an instrument in the United States because we're covered both the FDA marketing purposes and for remuneration from the insurance companies. So it will be covered.
Okay, so viewers, thanks for watching. Again, it's a painless injection system that dentists in America have access to. Tell your dentist that you want this, that you don't want to suffer getting needles anymore, especially for the children, but also for adults like myself who are afraid of needles. I'm not kidding. This is my new hero, Leonard Osser. The name of your company again is?
Milestone Scientific. The company, the division in dental is called The Wand, and the website is thewand.com, and you can go on that and find a dentist in your neighborhood that has our
That's
instrument.
it. No more pain. Pain-free dental. Thank you for watching. We're on Tuesday nights at 8 p.m., Channel 34 in Staten Island. We're on in Manhattan, Channel 56, and we're on in Brooklyn on various channels. Thanks for watching. See you again. Bye-bye. Hello again, and thanks for watching. We hope you enjoyed the show. And if you have any thoughts or concerns or ideas for a show or questions, please contact us. Our information is below. And remember, we want to know what's on your heart.